Hello, my name is Dr. Robert Fiala. I'm a board-eligible chiropractic neurologist, and I practice at Avenel Family Chiropractic, 245 Avenel Street in Avenel, New Jersey, which is part of Woodbridge. Welcome to my website. You've clicked on this link because you may be having back pain, you might have herniated discs, you may have had pain for a long time, you may have had back surgery, you could have had any sort of condition going on, you may have sciatica, you may have a herniated disc, whatever it is. I want to tell you a little bit about what we do, what I do at my practice, and how we treat people that may be different from treatment that you've had before. As part of a disclaimer, I do not treat or diagnose any medical conditions. People come in with all sorts of diagnosed conditions already, and that's fine. Whatever you're diagnosed with is whatever you're diagnosed with. The treatments are the treatments, and they're there not because of some diagnosis, but because of what I may find as a chiropractor. I also don't claim to make any results faster or better than anybody else. However, that being said, as a chiropractic neurologist, what does that have to do with you having back pain? Well, I'll give you a great example. If you take a look on YouTube and go research Montel Williams, you can find a video called Montel Williams Upper Cervical. In that video, Montel Williams explains how his chiropractor adjusts the top bone in his neck, and he has relieved him of his symptoms of multiple sclerosis that he's had for many years. He found this very miraculous. He brought the chiropractor on the show. It's a great testimony to the power of chiropractic because of its effect on the nervous system. Now, I'm a board-eligible chiropractic neurologist, and what does that mean? That means that I've taken a specialty within neurology within my chiropractic profession. We have many subspecialties like orthopedics, nutrition, rehab, etc., and I've chosen neurology. The effects on the nervous system of the body are fantastic. They are not to be underestimated at all, even with a condition like a herniated disc or some sort of back pain. The muscles of the back, first of all, are controlled very intimately by parts of the nervous system. My job, as a typical chiropractor, my job is to locate problem areas of the spine and to work on those using my hands or an instrument to realign segments of the spine or restore function. In my office, I look a little bit higher than that. I look up to brain function. Your brain has three really important aspects to it. It has a top part called the cortex, that big mushroom cap area, and then it has the stem, if you will, the mushroom stem, the very top part of which is called the midbrain, and then below that you have other areas called the pons and the medulla, which then link up to the spinal cord itself. Through that pathway, information goes up and down to and from the body. The tone of your spinal muscles, and these are small, tiny slips of muscles that lie in between each of the vertebrae, are set by parts of the nervous system. If there's any sort of an imbalance in there, if that nervous system is not working as a harmonious entity, if it's not working totally in harmony with itself, with one part neither working too much nor too little, with the right amount of feedback coming up from the body and the right amount of information coming down to the rest of the body, you maintain balance. Loss of that balance leads to muscles not having their correct tension, muscles not holding their proper tone, muscles allowing vertebrae to rub against each other, to allow bone to rub on bone, and then allow things like herniated discs. Well, we take this into consideration, and everyone who comes in here, whether they have back pain or whether they've been diagnosed with multiple sclerosis or fibromyalgia or migraines or whatever their medical diagnosis is, doesn't matter. I'm going to look at the spine, I'm going to look at the nervous system in all its aspects, and I'm going to find out what areas need to be worked on to increase their function. Areas like cerebellum, which is an area in the back here in the brain, controls your eye movements, also is linked up to your spinal postural muscles. When that malfunctions, you can have decreased tone of the muscles, which can lead to all sorts of problems and lead to things like herniated discs, etc. And if you don't fix that with the appropriate treatments, you really are not going to get better in your entirety as well as you could be. There may be some pain relief, etc. Which is why a lot of people have come to my website to look at the back pain areas and to look at the herniated disc areas because they have back pain. They've been through physical therapy. They may have been through chiropractic. So they want to know, well, what do you do that's different? Well, that is what I do that is different. I also have the therapies like decompression therapy. I use a multitude of different things to straighten up the nervous system. I work on oxygenating the body to get the proper amount of fuel into your nervous system. Your nervous system needs two things. It needs fuel and it needs activation of the proper type and the proper amount. Fuel is oxygen and glucose. We work on breathing with people to open up their respiration, to stop them from mildly hyperventilating, which is what I find a lot of people do inherently. When they have this, they may have a slouched over posture. It stops you from breathing correctly. We work on that. We open up these areas. We can then apply also direct therapy right to an area. And I don't care if you got a herniated disc. I don't care if you've had surgery. I don't care if you got rods and screws or whatever in your back. There are things that can be done for you. So it's imperative, if you do have one of these conditions, to give me a call. I'll be glad to talk over your problem with you. I'll be glad to give you a consultation at no charge. Let's see if we can help you. I also don't string people along. If I don't think I can help you, I'm going to let you know. If your condition is that bad or just not of the type that I think I can help, I won't accept you as a patient. Or if I do see you for a couple of visits, we'll know right away, and we're going to be able to make a decision, the two of us, that, yeah, this is going to work or it isn't going to work. But again, I'm not going to bump you along for a lot of visits that aren't going to get you anyplace. We can recognize this pretty fast, with the techniques that I do. So please give us a thank you very much.